diagnosed with type 1 diabetes when I was 8 years old, and I missed the whole first week of school. I was admitted into the hospital, and it was horrible. I was rudely awakened by a nurse in the middle of the night to poke my finger and get IV fluids. I had to have lots of needles with injections and doctors and nurses poking and prodding me. All I did was sit around doing nothing but watching the smallest TV with nothing on and no one to talk to but my mom. I had to learn how to calculate my insulin for the carbohydrates I ate. When I was in the hospital, I learned that eating meant that I was going to have to take a shot of insulin, so I would try not to eat. But my plan didn't work out in the end. At the time, I didn't know anything about how much insulin was or how much it would cost to manage my type 1 diabetes. I am not alone. The fact that millions of Americans go through bankruptcy from the cost of a medical treatment or prescription drug. Now I know that if my family did not have health insurance, it would cost $1,000 just for insulin per month, not including all the other medical supplies. Many families are dealing with children with type 1 diabetes and other life-threatening illnesses such as cancer. Therefore, we need to lower the cost of medicine. Today, I will discuss why we should not have to go into bankruptcy to get a medical treatment or a prescription drug. Secondly, I will discuss the causes of the high cost of medicine. Finally, I will elaborate the solutions to fix this nationwide problem that can help millions of people. These are some of the problems with the price of medicine being high. Most Americans cannot afford health insurance. According to Amy E. Chad, PhD, and A. Cohen, PhD, it states that 31.6 million Americans are uninsured. Even Americans that are insured have trouble covering the cost of health care. Many are rationing medicines such as insulin because they cannot cover the high cost of their monthly prescription. For example, I require 70 units of insulin per day, which adds up to $162 per month. That is included with my family's monthly bill of $400 a month for a full coverage insurance. My parents also pay for my Dexcom sensors and transmitters, and we're both $162. I also have an emergency medicine for if I pass out from a low blood sugar called basquilamine, which is $45. My individual pharmacy bill was over $550 with full health coverage. But without health insurance, my total bill would have been over $6,000 for just 1 month. This does not include my pump or my pump supplies, such as sites, cartridges, and syringes. According to James E. Dallin, MD, who wrote an article for the American Journal of Medicine titled, "We Can Reduce U.S. Healthcare Costs" on March 1st, 2010, states that patients that cannot afford prescribed medications, many patients stop taking their medication and have increased hospitalizations, further increasing our care costs. Another problem is the monopolization of pharmaceutical industry. For example, companies that are making cancer and diabetes drugs are monopolizing the industry. S. Vincent Rambu, who wrote an article for the National Library of Medicine titled "The High Cost of Prescription Drugs, Causes and Solutions." In June 2020, it states, United States, 3 companies, Novartis, Sanford, Avedis, and Eli Lilly control the market for insulin, contributing to high prices and lack of competition. And in the case of cancer, when there are multiple drugs to treat a specific cancer, there is no real competition based on the price because most cancers are incurable. There are life-saving drugs that save lives, and companies are jacking up the prices so that they can make a profit off of these people that would die without it. Another problem of rising drug prices is a lack of government regulation. James E. Dallin wrote an article for the American Journal of Medicine titled "We Can Reduce U.S. Healthcare Costs" on March 1st, 2010. It states that citizens of other nations pay 20 to 40% less for prescription drugs compared to what Americans pay. Most countries that have support for their health care, STC report the country ranking of healthcare in the world. All but 43 out of 195 countries in the world offer free or universal health care, which is ridiculous that we are part of the 43 countries and not a part of the 195. These are some of the causes of the cost of medicine prices being high. The reason that the pharmaceutical companies can monopolize the cost of medicine is because they hold the patents to these life-saving formulas. There are only 2 companies that own the rights to produce medicine, which creates a supply and demand issue. that allows them to jack up the price. According to Mark S. Levy, writer for the National Library of Medicine, in October 2016, it states that to capitalize on the opportunity, brand name pharmaceutical firms are patenting these drugs, consequently guarding the formulas and with it profits. Patent brand name firms market exclusively, which allows them to set their own prices. Another cause for the cost of medicine being so high is how much money and time it takes to make these medications. According to S. Vincent Rangu, who wrote an article for the National Library of Medicine titled "The Cost of Prescription Drugs, Causes and Solutions" on June 2020. It states that it takes about 12 years for a drug to move to the preclinical testing to final approval. It's estimated that it costs around $3 billion to develop a new drug. The third cause I would like to discuss is the vulnerability of families and patients in crisis. The big pharmaceutical corporations are prying on families and patients because they know that the families and patients are willing to pay the price to prolong or save a life. The families and patients are giving up things like groceries, car payments, and their homes to pay for the medicines to save their family members or themselves. My grandmother had a cousin who had a brain tumor that could have killed him. He was asked if he wanted to be put in a trial to see if they could officially get rid of the cancer. But it would cost them $10,000 just to have the trial. So they spent the money to save his life with no official guarantee that it would get rid of the cancer. Here's how we can fix this problem of the cost of medicine. We need to develop healthier lifestyles to prevent disease. And this is a small solution that we can do on a personal level. We can also donate money for scientific research and technology to cure diseases. Another solution that we can have is advocates go to Congress to develop healthcare reform, and if we hold our senators and representatives responsible for the cost of medicine and pass the bill to help those with medical costs. For example, the new law called the Inflation Reduction Act will cap the cost of insulin for Medicare beneficiaries at $35 per month. It will also include those with insulin pumps. This is a step in the right direction, but it does not include everyone that uses a prescription drug. Another solution is private companies such as Mark Cuban's new online pharmacy trying to lower prices. This could be a way that we could solve this problem without government support or taxes being raised. According to James E. Dallin, MD and PhD, who wrote an article for the American Journal of Medicine titled "We Can Reduce the U.S. Healthcare Costs" on March 1st, 2010. It states that reducing the healthcare costs, we can do this by developing a healthcare system that emphasizes prevention rather than disease management. To do this, we must provide them with new skills and cut down tests and procedures that we do not need, and then Medicare for all in the future. Today, we looked at why we should not have to break the bank to get those prescription drugs. Secondly, we discussed the causes of cost of prescription drugs being high. Finally, we reviewed the solutions to fixing this nationwide problem that can help millions of Americans from serious health risks or death. If my family did not have the money for my diabetes supplies like insulin, basculamine, sites, Dexcoms, transmitters, keto sticks, and all the other little things, I would be seriously sick or even worse, dead. Therefore, it is important that we try to reduce the cost of medicine so that others who cannot get health insurance do not have to break the bank to get those medications. They need to stay alive. When I was diagnosed with diabetes, it was a very crazy time in my life with all the doctor's visits and taking insulin every day to stay alive. Imagine how much worse it would have been if we could not cover those bills that would have saved my life.